Anthony Matto presented an encore of the phase 1/2 BRUIN study, the CLL population of patients who've been previously exposed to a covalent BTK inhibitor. So as a reminder, the agent LOXO-305, or now called Pirtobrutinib, is a non-covalent and highly selective reversible BTK inhibitor and doesn't rely on the CYS481 covalent pocket to bind to BTK and provide inhibition. So therefore is active in patients that have either progressed through a prior covalent BTK inhibitor, or indeed, of course, those that stop because of intolerance. So we know that's an issue with some of the agents we use in our clinic. And so this very high-risk patient population was presented. So approximately 250 patients, all had received a prior covalent BTK inhibitor. Most had received chemotherapy, a CD20 antibody. Approximately 40% had had a prior BCL2 inhibitor as well. And some high-risk features were prevalent, including p53 deletion mutations, and a number of patients with a CYS481 mutation. And what was presented was really quite outstanding efficacy. The overall response rate at present is approximately 70%. But actually, if you look at the waterfall plot, a lot of patients have developed a tumor reduction so far, and many patients are ongoing on therapy. So it'll be very interesting to see this data mature over time. And one of the striking things here is that the median progression-free survival in all patients across the whole group wasn't reached. And the median progression-free survival in patients who had 5 prior lines of therapy, including a BTK inhibitor and a BCL2 inhibitor, was 18 months. And really, this is unprecedented in this patient group to date. And responses were seen across all of the different subgroups, including patients who've received all types of CLL therapy that exists and that we know about. So chemotherapy, a covalent BTK inhibitor, BCL2 inhibitor, PI3 kinase inhibitor, and an anti-CD20 antibody. And so that really represents our armamentarium at the moment, and yet we're still seeing responses of approximately 70% in the small population of patients who've had all of those agents in the study so far. So very exciting times for this drug, and it's being moved forward to randomized clinical studies, and we'll hopefully see updates of the phase 2 cohort in the near future.